Brooke, John, these guys have been just incredible business partners, great human beings. I actually live in Dallas, Texas, and drove to Mississippi just to shake these guys' hands, just because of who they are and what they mean to so many people. I'm going to do a very short presentation regarding our company, but there's going to be one service that I'm going to spend a little time talking about called Impact Health. So our company is a marketing company. We acquire customers on behalf of companies like AT&T, companies like Spectrum. We also do utilities, gas, electricity, certain parts of the country. But there's been one service that was brought to us about 18 months ago called Impact Health. And Impact Health is a nonprofit healthcare company that was looking for customers. And so our agreements are we'll help bring you customers. We need a good product. We want a piece of the bill. We'd like to make a residual income on whatever it is that we market. Well, that was something I heard 20 years ago. 20 years ago, small business owner in America, always looking for additional streams of income. So this presentation was given to me 20 years ago, and I liked it. I ended up becoming a business partner with this company, and I built a large customer base over the last 2 decades. Impact Health is a disruptor, and you'll see a little more about that in a minute, but it is something that is bringing medical freedom, medical choice. It is building a parallel system, giving doctors what Jessica was saying, Dr. Jessica, where we're honoring different ways of healing people that traditional, as you're probably aware, health insurance won't even get near or even talk about. So we've got something extremely exciting, but it needs a little marketing. It needs conversation. It needs public awareness. And that's really what we do such a great job of, is bring awareness to some of the companies that we've been working with over the last now 30 years. So the company that I work with is called ACN. Just to give you a little backstory, this is the head office of the company. They're located in Charlotte, North Carolina. And what they do is very unique. They bring customers to major companies. Been doing it for 30 years. Worked with some of the biggest companies all of us know by name. They've helped millions of businesses and individuals save money on essential services. Now, just to give you sort of an understanding, we work with wireless companies and internet companies and television companies, companies like AT&T, Vivint Home Security. We help businesses save money on credit card processing. We offer travel for people that are looking to pay a little less when they like to travel, identity theft protection, something probably none of us thought about 15 years ago. Obviously, today's a different world with all the cyber situations we're all experiencing. So you can see that we've got a very unique array of services that we can offer customers. And it works like an Amazon. They go in, they shop, they look at pricing, they decide what service is best needed for themselves or their business, and they become a customer. Impact Health, this product right here is extremely exciting. One, the savings. This is major medical. So when you think about the Blue Cross or the United or the Aetnas, we're saving 30 to 70% less. So we're able to help people save money, whether it's a business that's looking to save money, offering healthcare to employees, or people like myself that have been paying for their healthcare for the last 20 plus years. Now, how is this possible? Like, how can we save people 30, 50, 70% is really technology. And if you think about technology, it's affected a lot of different industries in the last handful of years. The way we watch a movie, the way we travel, the way we go to the airport, even the way that we shop. All of these industries could have never been effective if it wasn't for technology. Health insurance has never changed. It's been the same antiquated, outdated way of doing things for the last 30 plus years. What Impact Health is bringing a concept to the marketplace that has been around for 4 decades called healthcare sharing, but has done it with the modern technology approach and bringing an opportunity for us to be able to disrupt an industry that I think we all would agree needs some disruption. Now, it needs a little explanation. What I did is got the CEO and the president of Impact to do a very short video talking about Impact Health, talking about this service specifically, and then I'm going to come back and talk about how do we get paid? How do we make money promoting this service? And how can we work in hand with Impact to bring awareness to this product all over the country. So I'm going to show a short video, and then I'll come back and I'll talk a little bit about how we get paid doing what we're doing here tonight.
Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing grew over 1,000% in the last decade alone. Why? Because it's an alternative to the high cost of insurance. Typically, you'll pay 30 to 50% less. Some reasons why? We're not for profit. So we have no profit motives that typically cause conflict between members, providers, shareholders, and the executive team. None of that exists with healthcare sharing and certainly with Impact. You can stop overpaying, my friends. Here is a quick video that highlights the opportunity for all of us to be a disruptor in the industry. Enjoy.
Healthcare spending made up 5% of total U.S. GDP in 1960. In 2020, spending hit almost 20%.
National polls show Americans believe healthcare prices and drug costs are among their top pocketbook concerns.
Over the past 20 years, the runaway cost of health insurance has outpaced earnings and inflation, leaving our families with less freedom and less money. Families, small businesses, and individuals alike are struggling to find a way to pay for the healthcare they can't seem to afford. So how are we going to solve this problem? All over the world, technology is changing the way people and society connect and interact. The result? Countless industries are disrupted. But while the rest of the world has changed, insurance and the way we pay for healthcare remains broken and largely the same. What if there was a way we could all pay for healthcare that simply worked better and felt better than insurance? Well, today there is. We are Impact Health Sharing. We are a network of families, individuals, business owners, and small entrepreneurs who want to see the old way of doing things change. We use technology to connect tens of thousands of individuals and families across the nation to simply share and pay each other's medical bills. Old problems can be solved when people come together to leverage their sense of community with technology to control the cost of healthcare.
My friends, what we are simply doing is leveraging your sense of community with technology to control the cost of healthcare. I hope you'll join us. Next, you'll be introduced to our marketing partner, ACN. You will see an exciting suite of essential services that are available to you. Thank you for your time.
So Impact, as mentioned in video, is healthcare sharing. And I'm sure probably some of you, if not everybody, might have heard of healthcare sharing before. I personally never have. Been in the Christian community for 30 plus years. It's had a lot of success in the space, but it's been very boutique. It's been for just a small section of society, and they weren't really looking to mass market it. They just wanted to take care of their own, really create a really special experience for a handful of people. Well, when Impact was developed, it was made to look like insurance, work like insurance, feel like insurance, just not cost like insurance. So I had been with a company called Blue Cross. That's my beautiful card. Don't come to the emergency room without $600. That was $2,700 a month for my family of four. Totally typical. I shopped it every year. I was paying $2,700 a month for my family of four. When Impact came, I went in for a quote. My quote came back to $628. I'm saving $2,000 a month on my major medical. Now that was 36 months ago. 18 months ago. I've saved over $36,000 in the last 18 months back into my pocket. Got my Impact card in the mail. You can see if I got to go to the ER, bring $150 with you. So just the provider fee is literally 60 and 70% less than I was paying with Blue Cross and Blue Shield. Now, just to give you an understanding, what we do is create an online store. So we create an online store for people to go to sign up for services. So Sally has her own online store. I have my own online store. This happens to be the Texas Chiropractic Association. So this is their online store. So what they're doing is exactly what I'm doing, informing people about this particular product. Now, what's unique about it is the customer can come in, can go right to healthcare, can get a quote when it comes to major medical. So just to give you sort of a visual, everything's being done by Impact. They can get a quote right here for a family. If they have any questions, they can put their information in here. Somebody from Impact will call them, and this number would give credit to whoever put that customer through. So just to give you an idea, let's say that I was going to give somebody a quote and they were born in 1971, right? Over the age of 50, let's say they're a single person. They can get major medical, again, for as little as $288 a month, all the way down to $150 a month. The difference would be the deductible. Now, let's say that they're a single mom or maybe a married couple. This is for two people. Let's say they have 5 kids and there's 7 people on the policy. You can see how from $2,500 deductible would be $628 a month. Now, let's say they had questions. What about chiropractic? What about physical therapy? What about mammograms? What about this? What about that? All that information will be talked to and handled by Impact Health. So what makes it so special is none of us have to go to college and get a bunch of degrees and get a bunch of licensing or anything like that. We're just referring the customers to Impact. Now, I've referred thousands and thousands of customers just in the last handful of months with this product. Now, here's how we get paid. Here's the benefit of the opportunity behind it. So let's say, for instance, you like what you hear and you're sitting tonight saying, okay, I like what I hear. How do I get paid? Well, that online store that I showed you, ACN will create for us. The cost to become an independent business owner is $299. That's one-time payment. Started my own online store. $25 a month is my only overhead cost or my additional cost, and they create an online store. They do all the marketing, they take care of all the tracking of the customer, they take care of all the customer support, all the billing. Nobody calls me, nobody calls you. They're going to call these major companies that we do business with. So if somebody has a question, none of us are going to get bogged down with any of that customer care. That's going to be taken care of by the companies that we do business with. Now, here's how we get paid. When I first got started, what did I do? I'm originally from Pennsylvania. I went to see my mom. She happened to have electricity at her house. She happened to have natural gas. She was on the television. She had internet at her home. She had a cell phone in her hand. So although she was one person, she was using multiple services. I saved her money on every single service that she was already using. Didn't ask her to buy something she didn't need. Didn't ask her to spend money she wasn't already spending. Can we agree this was budgeted money for her on a 30-day basis? ACN will pay us bonuses for those customers coming in, and then every month we'll get a percentage of what the customer spends. So let's say that, Albert, you referred this to people and they decided to become a customer of Impact. Every time they pay their bill, you get paid a percentage of their bill. So you're going to make anywhere from 3% all the way to 20% of the bill for as long as they use the service. Now, I referred customers 20 years ago. Guess what they've done every month for 20 years? Same thing we've all done. Paid our bills, paid our cell phone bill, paid our internet bills, paid our utility bills. And every month for 20 plus years, I've gotten paid a percentage of customers that I referred one time 20 plus years ago. Now, I did what Sally's doing here tonight. Now, unfortunately, I wasn't as powerful as her and didn't have the reach she has or the amount of people that she knows. I just called people I did business with, right? Family, friends, people I socialized with. And I said, come take a listen. Come listen to the presentation. Somebody else gave the presentation. Somebody else explained what I'm explaining here tonight. A couple of people said, Patrick, thank you, but no thank you. I just want to save some money. They went out, saved a couple bucks on their services, and 20 years later, they're still saving money, and I'm still making money. But there were a handful of people that said, I like this idea. Can I do what you're doing? And the answer was yes. They can have their own online store. Anybody you and I introduce to this, if they decide this is a business they'd like to do, you get paid a percentage of the customers that they acquire. So imagine for 1 minute, You referring this to someone like me, I go out and get customers that you don't know. Every time my customers get a bill, I get paid, but so do you. And here you are getting paid 4% every month on customers that other people go out and get. Now, what makes this so powerful is the efforts of other people. Meaning, I haven't found one person that I talked to today that is in one or more ways dissatisfied with the skyrocketing cost of healthcare. I haven't found that person yet. Now, I know if you work for the federal government, you get free healthcare. Yeah, that's a different situation. But can we agree most Americans, most business owners, most people that either have to pay it for themselves, provide it to employees, or the employee themselves have to pay a percentage in order to get healthcare in the country we live in? So what I did was very simple. I started bringing it to business owners. Now, you see, I took the Chiropractic Association and people that are in that particular world because they're interfacing with customers every day. So there's a real opportunity for them to bring something very unique to the market. But just to give you an idea, this is business owner. I want you to introduce you to one of the business owners that I was able to help when it came to Major Medical. And I love just hearing his testimonial because I think we all can relate to what he's saying here. And I'll just give you a little understanding of what he saw as a customer when it came to Impact Health.
Thanks, Harsh. I appreciate you having me on the call. Yeah, I've been in the aerospace industry going on 40 years. We have 130 employees between two facilities, one here in Connecticut, one in Fort Worth, Texas. And we currently are offering Impact as an option to our standard insurance offering with Cigna. And we have 9 employees that have taken advantage of that so far. Others are very interested. And just with those 9 employees, we're saving $7,000 a month over what it would have cost us with Cigna. Not only that, but this past year, our renewal with Cigna was over $1 million. And we got a quote from Impact. And if all of our employees switched to Impact, that cost would be $360,000.
So imagine helping a business save over $500,000 on their healthcare. And I've got many other examples, but I'd like you to hear from Dr. Mara. She is a pediatric physician. She has 3 clinics, over 10,000 patients, New York City. So if anybody knows anything about New York, it's difficult enough to live there, let alone do business there. And listen to what she has to say, especially from a provider's perspective, because I know this will ring true, at least ring home to you as far as the provider's perspective.
Hi, everyone. This is Dr. Mara. We are very excited because we are now accepting Impact Health. And these are the few reasons why. Number 1 is the approval process is so simple. It's right on the spot versus other insurance companies. It takes about 6 months to even 9 months for us to get approved. Second, we get paid more with Impact Health Share compared to other insurance companies. So providers love it. And the third one is we get paid fast. Within 10 to 15 days, when we send our invoices, we get paid right away. So there is no reason.
So if you hear what she said, we get paid more and we get paid fast. Now, I'm not a provider, so I didn't know that getting paid in less than 30 days is like a big deal. So what's unique about this is there's no network. They get to go to any doctor they want. Johns Hopkins, Cleveland Clinic, Mayo, any doctor at all in the United States, we can bring this to, and that doctor will get fully paid for whatever the reimbursement is for whatever they do. Now, when I brought this to Dr. John, he had a whole different outlook. You heard from Brooke. Brooke's an amazing person. You know, she's in the real estate space. I think you probably have all moved into a home at one point in your life. What's the question we all have? Where do we get the internet? Where do we get the cable? So we create a very concierge-like experience for someone moving into a home so they can get all the services at the touch of a mouse. But Dr. John has a whole nother perspective on what we're doing here tonight. And Dr. John, thank you for being on here. I know how busy you are. And great to have you give us a couple minutes of your evening, but maybe just see what you see in some of the other people in your world right now when it comes to Impact. Dr. John's met the CEO of Impact. He's been very intimate with them. They were just on Yahoo Finance last week. They paid over $15 million in medical claims. These guys are growing very quickly, and maybe you can give your perspective and really where you see this thing going.
Yeah, thank you, Patrick. Yeah, thank you so much. So my name's Dr. John Witcher. I'm a medical doctor in Mississippi. I'm a general practitioner for the last 25 plus years. I left the clinic setting probably a little over a decade ago, and I've been in the ER and hospitalist for the last a little more than a decade. And so when COVID hit, that's where I was. And I've been really against the pharmaceutical industries for a long time. I know, they push many times medications that are dangerous. We saw many things over the years, opioids, for example, all the harm that it caused. And so when the mRNA vaccines came out, I never promoted them because I felt they were dangerous. Of course, that got me on the radar. And then, I eventually would not give my patients remdesivir and wanted to put them on things like ivermectin, hydroxychloroquine, and so that got me fired. And so, the medical industry is broken, and the pharmaceutical industry has really taken it over. Not only from a governmental standpoint, the CDC, the FDA, but it's all the way down to the medical organizations, the medical journals, and now commercial insurance companies. And so, there's going to come a time shortly that if you're not fully vaccinated for COVID, for example, you're probably going to lose your health insurance. And so, we've been in this medical freedom fight for all throughout COVID. And, that's really what I'm passionate about. I mean, this company is a very credible company. We flew up to Charlotte, North Carolina when we got involved a little over 3 months ago, and met one of the four co-founders, Greg Provenzano, and he's just the guy of integrity, just like Patrick is. These are people that we felt good that we could align with. They're very ethical. This is Impact Health is a Christian company. And so, they're not going to pay for abortions. They're not going to pay for transgender sex changes or hormone therapies. They don't even pay for vaccines. And so, this is a company, ACN's a company, Patrick is an individual that I can align with. And then Impact Health is also a company I feel good about. And so that's our passion, is to wake up people, to get them out of the broken healthcare system. And Impact will do that because you can go to any doctor you want to, any hospital, and you're gonna get taken care of. And also Impact Health, like Patrick said, we're working with the Phil Chrysler, the CEO. We have many people in our organization. We've been in a little over 3 months. We have over 70 business partners, over 350 customers. Many of our business partners are from the health freedom movement. We have other doctors. If I said their names, you would know them. And we have influencers, podcasters, etc. And we're all in the same alignment. We want to build a parallel health system, get out of the broken healthcare system, and we believe Impact Health is helping us do that. Okay, it allows the doctors get paid quickly. They get health sharing is the way this works. It does work like health insurance in that you have a card, and so you don't have to pay up front and then get reimbursed. The doctor can do electronic billing, and it works fabulous like that. And so, but ultimately, this is about fixing our broken healthcare system. So that's what we're excited about. We're so excited to be. Patrick is our team leader. He is a fabulous teacher, mentor, and we're just honored to be a part of this program. Thank you.
Well, Dr. John's done a great job, and just really love his passion and willingness to help. And Brooke, who's been able to do the same and just really align themselves. Now, as mentioned, all the other services I don't need to explain. AT&T, Spectrum, that's why I don't really talk about them. They're there. It's very simple for someone to become a customer, and the benefits are self-explanatory. Price and a little better than maybe what somebody has now. But Impact Health is the only product. The smarter they are and the richer they are, they see this. Meaning, he introduced me to Folson Foster Colson. He owns the wellness company. I've been on 7 Zooms with this guy, and he's smart and he's rich. And this guy specifically, like, look, what you're doing, I can get behind because it's not insurance. So what Dr. Jessica's doing, we would fully take credit, meaning give credit to the patient for going into an alternative way of healing because it's better for the community. Does that make sense? Because if you think about it, the 6 of us were medically sharing into each other's medical bills if we were sharing, and somebody wanted to say, hey, Barb wants to come in and she wants to take vitamins and she wants to do IV drips and she wants to exercise. Do you want her in the share? Yeah. Why? Because she's healthy. And the concept is creating an environment of people that rewards them for being healthy, rewards them for doing things that work, that unfortunately, as we all know, the traditional health insurance industry won't touch. So we're going to build something very unique. It needs a little explanation. And the reason it does is I'm saving $24,000 a year. So Google's not going to get me to jump into something that I'm going to save $24,000 a year. I mean, I need a Facebook, Google, a billboard on the side of the highway wouldn't have got me as a customer because I need, certain questions answered. Now, if Dr. John or Jessica or Albert or Sally were like, hey, take a look at it. I'm a smart person. I'm going to look at it. I'm going to ask questions. I've got kids. I've got people in my life, like all of us, that I would bounce it off of to say, hey, tell me what you see here. And everybody that I brought it to all sees the same thing. 1, savings speak for themselves. 2, the fact that it's ethical in regard to paying the doctor and paying them quickly and not trying to hold the money because we're a nonprofit 501c3 that the entire goal is just to pay the medical bills of the members. It's like a credit union for healthcare. If you think of what credit, they're doing the exact same thing. They're just doing on a massive scale, and technology's there to a point now where we can do something we couldn't have done 30 years ago. So if you like what you hear, we'd love to do something together. We're very, as you can see, pretty passionate about, I mean, I could go on all night about this. I mean, I've been going all day about it and I could go on all night about it, but I just feel timing has a lot to do with success. And as we watch people lose their jobs, they lose their health care. And in some cases, good. You don't even get rid of that. Come in here, come actually with Impact, get yourself fully covered and do it for pennies compared to what everybody's used to paying. So I know I went on, but if anybody has any questions, Sally, obviously, we're very, very excited about having what she stands for, the stand she's taken, the people that she's out there helping. I just think there's no accidents. All of us are coming together. Like everybody's coming together and seeing a lot of the same things. ACN just can pay that they couldn't pay before. Does that make sense? Meaning for bringing the customers in, for telling people about it. Now that I'm in the space, like I've had people like, oh, I've been on Medishare for 10 years. Well, great. Why didn't you tell me? Oh, I get it. You didn't get paid to tell me. Now, if you got paid to tell me, guess what? You might want to take lead Blue Cross, come over here. It's a better product. It's better for your family. It's going to be a better opportunity. So that's to sort of give you the high level. If you do have a question or like what you hear, feel free to ask anything. We're more than open to discuss anything that was shared with you guys tonight.
Albert or Jessica, do you have questions?
Let Jessica go first. I got a couple. Or yeah.
It sounds absolutely wonderful, and I'd like to find out more about it. And it's what we need. There's no hope in the system that we have right now.
Yeah.
And we do need to come together and to work together and help one another. I think that unity is so important.
And Dr. Jessica, just to be clear, let's say that you have a patient that is using red light therapy. they're going to give them a credit off their deductible every month for just doing it. So think about things that you would love to be able to say, and you're just a microcosm of a bigger scope to say, hey, look, you're doing things to put yourself in a healing position. We want to reward you for that. And we can't have a billable code on it because it's not a billable code. So we're going to take that receipt and upload it and take it off your deductible. So now if they're on a 90-day, 120 next 6 months, this is what they're doing. So there's all kinds of beautiful things from naturopaths to other type things we all know that works, that we're going to reward them based on the fact that that's our kind of people. You know what I'm saying? Like, we want them in our world. We want to incentivize, we want to help pay for the things that they're doing to get healed and get healthy.
Wonderful. Thank you.
Mm-hmm.
Yeah, so early in the 90s, we did this at my stepdad's clinic here in San Jose for his own patients. And my stepdad, Dr. Albert Gomez, was a homegrown Hispanic doctor here in San Jose. So he was like the very first one, Hispanic here in San Jose. So everybody knew him in the Hispanic community. And he was also an INS certified physician, so he did immigration physicals. He did a lot of immigrations, and he got in. He knew some, since he was a local guy himself, he knew people at the San Francisco consulate and the San Jose consulate. So he had a little table in the consulate doing blood pressures on people and then getting them, hey, come to my clinic, or when it's time to get your physical, do the I-693 forms. I still remember the name. But anyways, from there, he would basically call it preferred patient, right? Be sure not to call it an insurance card, or maybe you can call it a discount card, but he, on his actual little, we would laminate the little patient's card in our office and give it to them. But it was upfront pricing. He charged them like $375 a year for a family of 4, the upfront pricing, and then $40 office visits and $20 injections. And here it was, and only 4 injections: Rocephin, Depomedrol, amoxicillin. That was it. But the point is that no matter which one you needed, even if it was Rocephin, it was $20 a cc or something like that. Mm-hmm. But anyways, it was really popular, and I see that trying to be created again. It actually was created on a state level in the 2000s. It was here in California. It was called MDVIP. Same concept, exact same formula, and I don't know what became of them. I looked them up recently and I couldn't find them, so I don't know if they've changed names or did something else. But then I see like Simone Gold is basically trying to do something similar to that, or if not the same type of thing. But with that being said, it was a little bit, what we would tell our patients is to say, hey, look, you're covered in San Jose. If you're in Los Angeles in Disneyland, it's a little bit different. We don't have our connections over there. We don't have our MRI facility or X-ray facility, or we're still contracted with Lab. I think at the time we got a great deal with Quest, or something. But the point was like, okay, when you're in Los Angeles, if you couple our product with a catastrophic only coverage with Blue Cross Blue Shield at $15 a month for catastrophic, you're covered at Disneyland. So something like that. So my question was, let's say me as a patient, I get Impact Health. What happens when I'm traveling? What happens when I'm here from San Jose, but I go to Disneyland and I break my ankle on one of the rides or something?
So first of all, that's never going to happen. But let's say someone does, right? So here's the card. So as you can see, it has all the provider fees like free WebMD, nothing. See a doctor 7 days a week, 24 hours a day, outpatient, ER, all that. On the back, we have what's called an EDI payer ID. That is what links us to all the clearinghouses around the country. So when the doctor said, I got contracted on the spot, if they're not contracted, they will immediately, so they know what the reimbursement is. Hey, what do I get paid for a hip replacement? What do I get paid for EKG or whatever that procedure they do? So they immediately know what they get paid, and they get paid fast. So you're free to go to any doctor that you choose. Now, on the doctor side, on the Dr. John and the other, we do not have a protocol. What does that mean? So if red light therapy is the direction that the doctor feels that's the best avenue, we are not handcuffing the doctor with saying, you got to do this, you got to do that, follow our guidelines, if you will, on how to treat the patient. So it's good on the provider side because they can practice medicine and do what your father's done and heal people. And on the customer side, they're not getting crushed when it comes to pricing. Now, it does check the mandate for California, which unfortunately still has the state mandate where you have to have health coverage. This does check that box. So if you're the employer and you want to give health care to your employee, they're not going to get penalized for not having health care. So that part is still 100% standardized in the way that we would approach. Second of which, all customers can talk to Impact. So let's say they have questions. Hey, I have, my mom's got a little bit of an issue, or my sister wants to know about if her doctor would be covered, or wants to have a baby at home, a midwife or a doula, or all those questions. Answers yes, but they can talk to Impact, and Impact's a nonprofit organization. So they're genuinely there to help. I mean, they're not profits over people. This is not about denying claims and trying to make as much money as humanly possible. It's about healing the customer and doing it in a way that allows for them to be fully covered without having to spend the money that America's spending right now for healthcare.
And as far as like from the provider position, and I say, well, so I see the EDI number, the electronic data interchange number, so I could submit my insurance claims electronically to Impact Health, which I'm assuming that I will also get my electronic funds transferred to the bank and my electronic EOB, my electronic remit through coming back to me, right? So I could post the explanation of benefits into my billing software.
So as a provider, yes. As long as you're connected up, you transfer the bills, we look at them, we pay the company. We also, as a community, we have the software to show you real time, like here's the money. So this is my back office with Impact. So this is the Impact software. Now, what's so unique about this is we get a chance to see financials, money coming in, money going out, where's all the money at? All that information is completely transparent. Now, they own this technology, and this is what's going to let them scale to millions. So if you take a look, this is the community, the money we've collected, the money we have sitting in our account, the medical bills for the doctor, all that stuff we're showing the consumer, including medical bill replacement, things that I didn't know happened. So this is my personal medical bill, a $3,000 ER visit, repriced down to $288. So they show you what amps they all do it. They just don't show the customer they're doing it. So we're able to show pharmaceutical pricing. People might go, hey, I need to take a certain drug, let's say metformin. They're going to show you real-time pricing for pharmaceuticals. So we don't make any money on drugs, so we're giving the drugs away at the cost. So it's not a profit center for Impact. It's nothing but a way for us to be able to serve our clients and be able to do it, let's say tablet form, 500 milligram, 30-day supply. This is my address where I live. It's going to show me all the pharmacies around my house, $1.51, $1.71, $1.58.
That's for a monthly supply?
Yeah, that's a 30-day supply of metformin.
And the normal cost or the average cost without this discount would be About what? How much?
$20 to $60, depending on the insurance company you have. So they're gonna make money on that. So what I didn't know, and I don't know how much you want to know, but it's a profit center. So every time you walk into that pharmacy, as soon as you show them your card, they've already pre-negotiated the profit on that drug. So as soon as I go, hey, I'm with Blue Cross, I have literally a picture of my phone. So I went to CVS. Unfortunately, I needed, I had a cold. And so they were like, oh, it's $70 for the drugs. I said, oh, I don't have Blue Cross. I pulled Impact out and it was $23. So the same, they just reprogrammed it. You swept the card and went, I saw the screen. I took a picture with my phone. It was $73 and then repriced to $23. Because that would have been the profit that Blue Cross would have made on that particular drug.
Do you have a preferred laboratory? How about the diagnostic lab?
I think they have one on here, but I went to LabCorp and others, but they show right here. This one here. I don't know who this is. Grassroots Labs. Don't know anything about it, how it works.
Okay.
Panels.
Yeah, I think I heard or read somewhere in the training materials that there's some special deal with Quest, like if to do annual labs, but if you want additional labs that aren't part of the annual package, that Quest will give a big discount on those.
And you get a credit. So every member gets a free physical and every member gets a free credit of up to $150 for labs. So we're getting all of our members to keep going to the doctor every year for the physical, every year for the labs, which is completely free because we want to keep the community as healthy as possible. Now, as mentioned, just to give you some financials, let's say that you guys like what you hear. And you're sitting here going, okay, great. I think I could run some traffic here. I think I could, bring some people. Let me just show you being a referral partner. Meaning, let's say, Albert, you go, look, I found 50 people that are looking for this product, right? There's 2 companies, there's 25 employees each, it's 50 total. Great. You would make $1,600 to $2,000 a month residual. Now, go to 100, you would make over $3,000 to $4,000 a month residual. Now, what's nice about this is you get your very own landing page. All the customers talk to Impact. Everything gets coded back to you. You're not getting involved in doing anything but exposing the opportunity for people to save money. Now, if you look at what I did with the Chiropractic Association, we built QR codes for their waiting rooms. So that way, as people are sitting in the offices, they can go to Impact, they can get a quote, they can get their questions answered, and they can make a decision if this is a fit for their family. So what's nice about it is, Dr. John, Brooke, they got a passion for taking customers away from the big companies. You know what I'm saying? Like it's another win on our column. It's like, okay, we pluck one person off and put it in. But what's going to happen is what I notice happening. It's just gaining momentum. It's not going away. It's getting bigger because the awareness. Like I had a meeting today, and we'll send you the video audio recording. The lady got life flighted. Did you see that? They had her bill. She had a life flight. It literally a $60,000. They negotiated to 16 grand. Now they all do that. The only difference is if you were with Blue Cross, you would have been hit with a $60,000 bill. They didn't tell you, oh, by the way, we negotiated that bill after you pay. They take your 60 grand, then they negotiate it, then they split the difference or keep the difference. So, it's a really exciting space to be in, especially for like yourself and Jessica, where you're not getting out of character. You're still doing what you're doing. You're still being the person that you're meant to be. But we have a solution for the problem. And it's building a parallel system. It's building a nonprofit parallel system that is not here to get rich on the back of sick people. And it can scale to millions. Hundreds of thousands will be a stepping stone on the way to millions. When we got with them, I didn't understand it at first. Like, I've been doing this for 20 years. So look, if your cell phone doesn't work, Albert's still my friend. If his healthcare doesn't work, he's coming to my house, right or wrong. So, I mean, this is not something that I wanted to necessarily jump into unless I truly understood what it was. And the more that I understood it, the more that I couldn't wait to tell people about it, because I met the Dr. Johns and the Brooks and the Sallys and others of the world that are like, you don't understand. We're not even practicing medicine anymore. Like, we're literally being dictated by Big Pharma on what to do instead of doing what's right for the patient. And Jessica, I know you see that every day in what you do. You're bringing your solutions into people that have no idea those solutions even exist. And it's because they can't make money on them. They couldn't patent an apple. So, but Albert, this is right in your wheelhouse. I mean, we're just doing nothing but making public awareness. And it takes like 3 meetings. Like, it takes, like, by your 3rd meeting, you're like, oh, like, hold on. Are you telling me every real estate agent in the state of California that has no health care, that's struggling right now, that is literally walking around without health care because of the fact that they don't want to pay $1,800 a month because they haven't sold a house in the last 5 months? Like, yeah, we can fully cover their whole family for $300. I mean, just that.
One of the things that impressed me about Patrick was not only the much lower premiums that families are paying, but also on the deductible part, it's because it's per household,
unplug the country
family, and not per person. I mean, wow, that makes a big difference there too.
And Sally, I didn't know that my $6,000 deductible with Blue Cross was per family member, on top of my $2,700 a month. It's almost like you expect the spare tire in your car to work until you break down in the middle of the night and you get it out and it doesn't work. And you're like, well, it's a little late now to be upset at my situation because I never took a minute to really look at it. And so you're spot on. It's a family deductible. It's the whole family. Also, Albert, people that don't have a social, as long as they have an ITIN, we can fully cover them. And I live in Texas. I have a woman that her and her husband own a super successful restaurant. They're, Mexican descent. They actually have an ITIN number. They employ people. They've got bank accounts and houses, but couldn't get commercial health insurance. And with Impact, we fully covered their entire family, and they rolled it out to their staff as an option for healthcare.
I know all about the whole, we used to call them working uninsured.
Yeah.
For a more polite term, but and I actually found myself in that space because during the beginning of Obamacare, I was like, I don't want insurance. I don't need insurance, right? I'm here in San Jose. My daddy's a doctor. I'm a medical biller. I got a medical billing company. Like, if I get injured, I'll go to one of my doctor friends.
Right. Yeah.
I don't want insurance. I'm going to save myself, right? And I was willing to take the, if you didn't have insurance, they would ding you at tax time. And I was willing to take that pinch for $5,000 because I didn't have insurance on paper. I said I still would rather pay that $5,000 penalty fee because I'm going to end up paying more and never use this insurance. So.
And Albert, think about all those medical billing customers you have that will get a contract for all of them. When they see the reimbursement and they see we pay in less than 30 days, their second question is, how do I get your customer? So I quote them, show them, but this is all, once you give me your top 3 billable codes and I give you the reimbursement for those, it's like, okay, great. How do I get all your customers? And again, this is already in your wheelhouse. So you can do some, we'll go on a Zoom tour. Just put them together, let them see it, put them together, let them see it. And then they start going after their same situation and you're getting an override. So everybody's working together. There's a mutual benefit in all of us succeeding in this. But again, it needs a little explanation. This is not a product that'll sit on the shelf. We would all walk past it. We would all say, look, it's not for me. It's $288. There's no way that it's going to God forbid I needed it, it's, you know, is it supplemental? No, it's major medical. But I think you would be phenomenal. If it's something you want to do, you know, you'll be direct to Sally. So as she naturally brings people in, she'll benefit you, you'll benefit them. We'll work together as a team. And this is Sally, I know that you just got in, so it's not like you put everybody you know in front of it. These were your, you know, really key people that you wanted to see. And you guys should feel good about that, because I know she was very, you know, excited to show it to you and get a chance to, you know, see. And again, if it's something you like, great. If you say, hey, I just like to support Sally and refer people to her, she would be more than okay with that part as well. But if you're going, heck, I don't want to have her, you know, go out there without me, and I'd like to do it together, Brooke will schedule up a time and help you guys, you know, get started, and, you know, a little training that goes along with it. But just do what Sally did. See, I'm training her as I'm explaining it to you. Basically, how, as I hear it over and over again, it's the same questions. And again, once you start getting in the weeds too deep, impact's there. That's their job. You can talk to them, ask a million questions, you know, get the comfort level up with impact. We're just a marketing company, and they needed us. They honestly needed somebody to get in this to say, okay, you need customers. I know how to do one thing. I can get customers, and I can get a lot of customers. I wasn't passionate about getting cell phone customers. I was passionate about residual income. I just used AT&T. Does that make sense? Like, I wasn't AT&T. I didn't wake up at night and fall in love with them. I just fell in love with the reoccurring revenue I made from them. But impact went from my bank account to my heart. Like, this is big. Like, I can tell you how many people I helped get healthcare that were like you, Albert, that were running around holding their breath with kids. Like, I had one couple where, like, we don't even want to go to the doctor because we're afraid they're going to find something. I mean, imagine that's your mindset. Like, you know, because I have no healthcare. Like, I don't even want to go in case something's going on that I don't want to have to deal with. And so, I mean, what a situation in a first world country to be worried about. So we got the problem, and I think we've got a big solution here with this, and with you guys, and we have the most powerful weapon in the world right here. You can get people on a Zoom call, meet Dr. John. The more you get the chance to know who this guy is, the more you're going to be like, oh man, this guy's an American hero. I mean, I'm really just excited about what we're all doing here together. So,
you know, I have this thing pop up in my head, listening to, I don't know if you're familiar with Jim Corso. Corsi. He's been there with President Trump in DC and doing something, but for some strange reason, he has an app, starting up an app called HablaConSuDoctor.com. And I was really interested in that. And, you know, but anyway, so he's doing this, and this reminds me of like a doctor that I knew, Miliadair Severain. He was a Black French Fiji doctor from Stanford, and this is a decade ago, but he started like Stanford, basically labs online.
okay.
Like, and me being from a lab and being naive and all that, and I realized, like, I'm like asking the medical director at the lab, I'm like, why can't patients just walk right into the lab, into Hunter Labs, and then order the whole enchilada for themselves? They got to go to a doctor to get it, right? They go, oh, no, here's the short list of self-referring, you know, of self-prescribing labs. So you can't, a patient can't just walk into a laboratory and say, you know, I want the whole enchilada. I want the heart panel, everything. The physician has to do it. And so anyways, this Miliadair Severain, he figured out a way. He was the doctor, right? He was, you call up, you log into Stanford.com. He could use the name because he graduated from there, and then he would refer it out to a LabCorp or to a Quest.
Yeah, right.
And then forward you the results. But for all intents and purposes, he had circumvented that whole system, that whole idea of like having to go to your primary care physician and beg to get ordered, you know, some labs that you wanted or something. So, but it's all kind of rings a bell with me. you know, and of course, myself, I being on that side of it, I always knew you know, the owner, Chris Rydell, that I worked for 10 years, he was the whistleblower of the year 2011 against Quest and LabCorp. You know, he parachuted out of there. You know, he was in the lab space, and what they were doing is they were going around to doctors and saying, "Hey, doc, we want to be your preferred laboratory. You know, throw us all your PPO and, you know, your Medicare and Medicaid, and we'll give you a sweetheart deal for your cash pay patients." And like for my stepdad, who all his patients were cash pay patients, so the working uninsured, the Hispanics, right, all dealt in cash. But the LabCorp and Quest, they were coming in under the Medicaid maximum reimbursable. And, you know, Medicaid wants to have that's the rule. It's like, we get the sweetheart deal. If you're going to charge your cash pay patient $5 for a HIV and RPR test, then we want that deal. And if we find out that you're coming in lower than our deal, you're in trouble. That's what happened to LabCorp and Quest. And because of Chris Rydell, he's saying, I can't go around here. Hunter Labs can't go around and compete with LabCorp and Quest because they're coming in with better deals than they even give to Medicaid. And that's what they got. That's what LabCorp and Quest. There was 7 labs total. And the award was $252 million. But the real pinch that LabCorp and Quest and the other 7 labs took was not that $252 million. For one entire complete year, all the insurance claims that were coming in for Medicare and Medicaid, they had to do it for free from all the doctors all over. That was where they really had to pay the government. That the 200
they felt it, sure.
Yeah.
But it takes one person to do it. So I mean, and again, this is corruption on a level that we can't even comprehend. That's why this is such a blue ocean opportunity, because we're just plucking people out. Hey, market awareness. Hey, you got another option. Hey, come take a listen, and they have a 98% retention rate. People don't leave. Like, once you get in, because it takes a little re-education, but once you're in, you're realizing I'll never go back. You could get the CEO of Blue Cross to come to my house. I'm not going to give him $24,000 more a year. There's nothing they can say at this point. I've already used it in a customer and experienced it personally as a family. So this is an exciting space right now. And again, unfortunately, as things get tougher in the economy, this is going to be one of those, I have to, groceries or healthcare. You know what I mean? You're going to get to those places, unfortunately, lose your job, lose your health care. I'm in Texas. Elon Musk laid 12,000 people off. That's 12,000 people went to Cobra, which is the full cost of healthcare, which is extremely expensive and shocking after you lose your job.
Yep.
Yeah. So cool. There are other trainings and things that go into greater depth about all the different features of it. And I still have a lot more to learn about those features, but the more I learn, it's like, the more impressive it is. Like, how can you do this? You know, I mean, it's amazing, really. And like the special, the special program for seniors, 65 and over, right. And, the flat deductibles, and just the way that, the way things are covered, some things that you've already gone over, but pre-existing condition issues and so forth. There's just a lot of different, plus on this. And so it kind of becomes a no-brainer in some respects for people, like especially families or, people on limited incomes who are paying these outrageous insurance costs every month. And plus very large deductibles. Yeah. Because it's not only that impacts is per household versus per person, per family member, but the total amount of that is still less, than you would have been paying someplace else. in some cases even per person. So it's, I was very impressed with all the features.
And I know you'll be doing more presentations, inviting more people out, but you know, Albert and Jessica, if you like it, I'll have Brooke schedule up a time, show you how simple it is. You know, obviously questions will continue to come, but it'll start the relationship and get us moving in a positive direction. And you can invite people like we're doing tonight, and we're just having an open discussion. I mean, at the end, it's like, hey, if they just want to be a customer, Jessica's website's here. Go ahead, check out the services, save yourself a couple bucks. Hey, I want to be a member. Great, here you go. Albert's website's here. And what's unique about it is you'll find people like as I have that go, you don't understand. I've got a whole office of people. You don't even like, it's one of those, you didn't notice the car you drove until the day you bought it. Now it's everywhere. Like now that you're in the space, tomorrow you have 5 people be like, I have no healthcare. You're like, what is going on right now? Like, and it's money, 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 money. Nobody, if it was free, we'd all have it. There's not one person in Canada that denies it. They all take it. So if it was free, everybody would have it. It's just the cost rub that's really been so painful for us. And we can build a big distribution channel because it is something that for you with billable codes and people you know in the billing, wait till you start getting the doctors on board. The doctor's like, I'll give you every one of my customers. I'll tell every one of my cash customers, go to Impact. I get paid more, I get paid faster, and it's better than them walking around without anything, because in the end, I'd rather have them have Impact than having to deal with an appendix situation or something that you're not going to cash your way out of.
It really works great with the trend in, you know, membership concierge doctors that are having their membership fees, because a portion of that, you know, depending on what their service fee is, could be that goes towards that deductible. So it works well for them too.
Yeah, it's at the beginning stage, you know, and they have so much money because we're bringing in so many customers. They're getting creative to reward the customers because there's so much money coming in, because we're good at getting customers. They just weren't good at getting customers because it's something that none of us would have went to on our own without somebody trusted saying, hey, you might want to look at this. So the CEO and the president of Medishare stepped down 7 years ago, and they were the ones that put this together. So they're the ones that consulted with Phil, who was on the video, to build this. So they took all the positive of healthcare sharing and they took all the negative out. And not that Christianity is either negative, but you know, you couldn't be a Jehovah Christian, you couldn't be a Seventh-day Adventist Christian, you couldn't be a Mormon Christian. I mean, like I never even heard of this before. But now that I'm in the space, I'm like, oh yeah, I couldn't get into Medishare. Why? Oh, I wasn't Christian. So they were very boutique, and they had hundreds of thousands, and still do, people on their platform. So they took away the Christian restriction. Hey, we're still Christian values, but whether you're Jewish or Muslim or agnostic, come on in. You can become a member, and we'll fully pay into your medical bills. Mm-hmm. And that was hard for the employer to say, hey, you know, what's your, you know, are you a follower of Jesus? What's going on? You know what I'm saying? Like New York and other, I mean, you're in California, you know, I mean, that's the last thing that you're going to, you know, get people to want to talk about. We're here. It's like that question isn't coming up. We're taking you on. And once you're in, you're in.
Mm-hmm. So is ACN in the what is that? The space like insurance, not medical insurance, but investment, annuities.
We've never done anything license related. So we rented out the Shark Tank, and we filled a whole arena. I used to come to San Jose to do the events in San Jose for ACN. So our independent reps are primarily selling internet, cell phone, things that don't need a license to sell. And the companies that we work with are great at what they do. Vivint Home Security. So I just give them a lead, let them talk to the customer. And we use the warm market, friends, family, business associates, and all the rest to create those warm leads that want to hear more about a particular service. Mm-hmm. You know, my mom's a great example. You know, she became my customer, saved a couple bucks on her bill, and we never talked about it since. 20 years later, she's still using the service. I'm still making money. This is not license needed. So that's why we're not in the financial services world and all those others that require licensing and state by state and a lot of bureaucratic stuff to actually be able to make money and build a team.
Yeah. I remember the ACN name. I think I even had an ACN number once upon a time, a long time.
Yeah, I mean, we had Trump was our spokesperson for 10 years.
Yeah.
So Trump promoted us for 10 years. And then when he ran for office, he said, distance yourself from me, you'll be collateral damage. And he was 100% right. He was like, he would talk about having a little foresight. He was like,
that's right. You're bringing up
take me
up
off your
memories.
website. Don't act like you don't know me.
I remember ACN and Trump were pushing promoting a voice over
Yes.
IP phone, like a business phone.
That's right. I made millions on that. And that was before Apple, before FaceTime, before,
Yeah.
I mean, I was crushing it with that product. 08 and 09, we filled up we sold out the arena. You couldn't get another seat in the arena there. As what was it? SAP Arena.
Mm-hmm.
And stayed at the hotel right around the corner. But the point that I'm making is that we've always had a way of finding great products, but this one God touched. This one's divine. Like this one here is completely unexplainable. If you would have told me that I'm going to save people $20,000 a year on anything, I would have thought that would have been a little hard to imagine.
And it started in 2020, just before COVID hit, is when they got it going. So I don't think that was coincidental either.
No question. You're exactly right, Dr. John.
I was gonna say I don't think I think California is redder than people realize. I think they make it look blue or put it on paper that it's blue, but I swear I think we're more red. I mean, these guys are lying. These guys are lying to us. It's not as blue as people think.
You see New York City, you see the unions came out in New York City like, hey, we don't care. Like so again, I think we're really in a unique place, but what I love is you don't have to get out of character. Like this is right in line with what you guys believe in and preach. That's the part where Dr. John doesn't have to say something he doesn't believe. He is 100% fully in character with Impact. And that's the beautiful part about this is it just needs the word out. I mean, that's why we're going to make a lot of money, because we're just re-educating people. I'm never leaving. This product's so good. It's like, wow. I would tell people even I didn't get paid.